You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
My name is Fatimata Sanogo, and I'm a PhD candidate in epidemiology in the Department of Population and Public Health Sciences. My research focused on understanding the benefits of mind and body practices for patients living with type 2 diabetes. And why it is important to understand this is that just about under half of patients who live with type 2 diabetes are unable to actually achieve the glucose level under control. And at the same time, there's also been an increase in the use of mind and body practices in that population, although their benefit has not been clearly established. People living with type 2 diabetes not being able to get their blood sugar under a recommended level put them at a higher risk for just diabetes-related complication like stroke or heart disease. Right now, we have a variety of range to address blood sugar levels in people living with type 2 diabetes. But despite that, there are many who are not able to achieve reducing their glucose level under the recommended mark, if you want. And so about under half are unable to do that. And this affect disproportionately minority people. So that will be African American and Native American and Alaskan Natives and Hispanic people compared to their white counterpart. The big goal in understanding diabetes management is to really get a sense of how we're doing as a health medical community in terms of addressing and helping people. What we found in our research is that mind and body practices are effective at helping people with type 2 diabetes reduce their blood sugar level and it gives a benefits comparable to metformin, which is a drug that's used for diabetes treatment. So one of the implications in terms of treatment or policies, I would say, is that there may be a shift for policies to include mind and body practices as an effective non-pharmacological prescription, if you want, in addition to the drugs, pharmaceutical drugs that they're using right now for people to manage their diabetes. And that may actually help a lot because there are many patients with type 2 diabetes that found themselves having to use multiple medications. And then it can become stressful or people can become less compliant over time when they have to deal with multiple medications for a chronic condition. Another aspect to how it can inform policy is that it can help us in terms of equity and just access to practice that benefit everybody equally. Because right now, there's a lot of money that Americans are spending on mind and body practices or just complementary and alternative medicine in general. In fact, over $30 billion a year. But that money is out of pocket. So that implies that the people who can have access right now to those techniques like mind and body practices, if they're beneficial, are more likely to be people that can afford it and people that are already overserved by our healthcare system. And if it works, there is a need to allow this to be accessible to those people, the underserved in our community, perhaps by allowing insurance companies to cover some of the cost, so that there's an equity in distribution of something that works. So here at USC, there is the Imagine Health study that has been led by Dr. Mark Wagensberg and his team. And it is an intervention study where they brought a mind-body technique called guided imagery to a population of adolescent, predominantly Latino adolescent, in high school. And the intention of the intervention is to look and see if an early introduction to those techniques can support and reduce the risk to diabetes in those population at higher risk for developing diabetes, and how perhaps a technique like guided imagery can also help them in terms of not only stress reduction, but even just life behavioral choices in terms of maybe the food they choose to eat, or engaging in physical activities, all of those different behaviors that are actually beneficial to help and reduce the risk of type 2 diabetes. I'm very optimistic about the future of mind and body practices in chronic disease, just treatment, management, and prevention, whether it's type 2 diabetes, cancer, and other chronic condition. We see it more and more used even in clinical settings. For example, mindfulness-based stress reduction is a somewhat standardized mind-body technique that was developed by Dr. John Kabat-Zinn and is used widely in different clinical settings today. And there's been a lot of research that show that those techniques can help in terms of stress management. And there is also a lot of research that is still needed to really understand overall their benefit. But I can see the future of mind-body practices being just an integral component in terms of improving physical, mental, and emotional health, which then really can promote a whole person health, which is ultimately the goal.
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.